Hi everyone, it's Professor Williamson. I wanted to go through some of the assigned non-graded exercises found at the end of Chapter 10 that focus on ICD-10 PCS coding for the respiratory system. So I'm going to start out talking about the first 5, which are multiple choice or fill in the blank. Then I'm going to pause the video for a minute if you want to stop it and kind of take in everything. And then I'll continue on with the procedure statement coding, which there are 10 of those at the end of Chapter 10. You also should have your textbook open and your coding manual. As we are going through this, we will be discussing one of the focus areas that's coming from your feedback, which is focusing in on how do I determine what is the root operation for a piece of clinical documentation or an operative report. You can certainly be referring to the root operation definitions in Chapter 1 of your textbook. And also, you should have the root operation definitions in your coding manual. If you have the AHEMA ICD-10 PCS code book as your coding manual, the full definitions of the root operations are in Appendix A. So you will be hearing me flipping because I'm going to be reading the root operations verbatim from the coding manual. You are not expected. I have never memorized the root operations by definition. As you are coding these, you should be using your coding manual. You should be using your textbook. And then if you were coding in the real world, if you were actually doing the job of a coder, you would still be using your coding manual and, of course, the clinical documentation. And when you're working on your graded elements in this class, such as the quizzes and the midterm and the final, you are using all of your coding manual. When you're working on your assignments, your graded assignments in this class, you will be using your textbook and your coding manual and any other resources you want to use. So the first question, it says the physician the physician documents that a wedge resection of the right upper lobe of the lung was performed. Which root operation would be used to code this procedure? In the textbook, you're given 4 options. Option A is destruction, option B is excision, option C is resection, and option D is occlusion. One thing I want to point out is that in the clinical documentation, the textbook used the word resection. If you remember back in Chapter 1, it was noted that the physician or the surgeon can use any terminology they wish. They are not required to use the ICD-10 PCS definitions as part of their clinical picture. So, typically in medicine, you will note that the words resection mean cutting, basically. Doesn't necessarily mean the physician cut all of an organ out or part of an organ. It just means he cut. That's what it means from the physician's standpoint. But from the ICD-10 PCS standpoint, we have very clear information about what is defined as excision versus resection. So in this case, the physician is doing a biopsy. It happens to be a wedge resection. That's the word that's used in the clinical information. It's a larger piece of a biopsy than, say, a needle biopsy, which is a very small amount of tissue. He's taking a larger portion, but he's still not removing, the surgeon, is not removing the entire right upper lobe of the lung. Therefore, per our coding system, which in this case is ICD-10 PCS, the definition that fits is the root operation of excision. Excision is defined as cutting out or off without replacement a portion of a body part. So because this surgeon is not removing the entire upper lobe of the lung, we are going to use the root operation of excision in this case, and that would be option B of the 4 that you were given. Number 2, this surgeon is doing a reversal of a previous lip augmentation procedure. Talks about the incision was made, a strip of tissue. How is this coded? And in your coding book, your textbook, they give you 4 options. Each option has 2 sets of codes. For example, option A has the code 0CQ1XZZ and 0CQ0XZZ. One tip is that when you are confronted with a question that's formatted like this, where you're given codes or code sets as your possible answers, and you're given multiples, typically 4, either 4 codes or 4 code sets, the best option is to code it. Don't sit there and try to look up each code and figure out which ones are fit. Because what's going to happen is you're going to run out of time. Whether you're working as a coder, it's going to impact your productivity. Whether you're taking a timed event in this class, it's going to impact your time. Or you're taking a national exam, certification exam, you're going to run out of time. So you should go at this the same way you would even if the options were not there at all. Well, how would you code this? What is the root operation? It says this patient is having a reversal of a previous lip augmentation procedure. There's no information that this is a medical reason. There's no information that the patient has a burn, that the patient's lips aren't working properly because of some anatomical component. So based on our review of our root operations, the best root operation that would fit is alteration. Alteration is defined as modifying the anatomical structure of a body part without affecting the function. And in your AHEMA codebook, it says explanation, principal purpose is to improve appearance. Includes and examples are a facelift and a breast augmentation. So, alteration is our root operation. We would code it out. We know the anatomical location, which is lip, happens to be both lips, plural. So we would code it out. We get to the 0C0 table. And we would end up with code 0C01XZZ and 0C00XZZ, which happens to be option C of the 4 you were given. Number 3 is a fill in the blank. It says the cornea is located at the blank of the blank and separates the openings to the right and left. Based on our clinical knowledge, either because we know it or we reviewed it in chapter 10 on page 199, for example, we know the answer is the cornea is located at the base of the trachea and separates the openings to the right and to the left. Number 4, the patient has a well-circumcised radiopaque spherical mass of the right parotid gland that was diagnosed as a ciliolithiasis, that this mass was removed through an open incision. When we look at this word, we say, or given the clinical information, first they say it's a mass, and then they say it was diagnosed as a ciliolithiasis. That's definitely a tongue twister for me today. But part of that word, based on your medical terminology, within that word is the word lith, L-I-T-H, which equates to stone or calculus. So this patient has a stone, most likely started out in their salivary gland and now has migrated to the parotid, and it is a hard substance, just like a stone outside. If you pick up a stone on the ground, it's a hard piece of matter, in this case, biological stone. So the root operation to remove a hard piece from the body or something that's solid is extirpation. Extirpation is defined as taking or cutting out solid matter from a body part. In this case, the body part is the right parotid gland, and it is excised or incised because he makes an open incision to get to this particular stone. We would index the root operation of excision, and then the anatomical location. I'm sorry, I misspoke. We already established the root operation is extirpation, so we would index the root operation of extirpation and the anatomical location, which is parotid gland, and we need the side of the body, which is right, and that relates to the value of 8. We know it was done via an open incision based on what we were told, so the reflection of that is 0 for the approach character value. No device was left in the patient, no qualifier, ZZ, so we end up 0CC80ZZ, which happens to be option C of the 4 that you were given in the textbook. The last one of the 5 multiple choice states tonsils completely removed by the use of a wire snare are coded to which root operation. The key I highlighted here in yellow is that the tonsils are being completely removed from the patient's body. That is the direct interpretation of the root operation of resection. So the 4 options you were given, which is alteration, excision, fragmentation, and resection. Resection is the correct one, and that happens to be option D. So like I said earlier, I'm going to stop for a second. If you want to stop the tape and look at what was just reviewed, or possibly you're stopping and you're coming back later. Okay, so moving on, we now have the procedure coding statements. There's 10 of them. For some of them, I think I typed it out pretty much directly. Some of, like number 5, I think I abbreviated a little bit in terms of what I typed in terms of the exercise statement. But for number 1, in your textbook, it says endoscopic placement of an intrabronchial valve into the left lower bronchus for persistent air leak. So we know where this is being done. We know it's the left lower bronchus. We know that they're putting in an intrabronchial valve. The reason they're putting in is because the patient has an air leak. So we know anatomically that air outside of your lungs or air outside of your bronchus going into your chest cavity is not a good thing. We want the air in our lungs, not necessarily outside of our lungs, inside of our body, but inside our chest cavity, but still not in the right place. We also know that it was done endoscopically based on what was told to us. So they're putting in a valve into this patient's bronchus to help with this air leak this patient is having for whatever reason. If we had the entire record, we would have the diagnostic piece, but we're not coding diagnosis in this class. We're coding the surgical event at this point. So all we really need to know is what was being done and how it was done. So when we think about this, they're putting in something into this patient's body. What is the root operation? They're not taking anything from the patient. They're not taking a piece of his bronchus. They're not taking a piece of the lung. They're putting in something. They're putting in something into the patient. That is the root operation of insertion. We would index the main term of insertion. Then, of course, the anatomical location. We get to the 0BH table. 0BHB happens to be. And then we have the endoscopic component, which is 8. And then when we're at that row going over, we're 0BHB, body part value B, then 8 is for our approach. That particular row, moving across, we only have one option for device, which is G, And G is intraluminal device, endobronchial valve, which is exactly what we want. And the last character value is Z. So we end up with 0BHB8GZ. The next one is an excision of a vocal cord polyp on the left side via an endoscope. Hopefully we know, based on past experience in this class at least, that a polyp is not solid. A polyp is typically composed of fluid, whether it's clear fluid or infected fluid, which could be termed as pus. And sometimes there could be something else in there. It could be mucous membrane, it could be tissue, but tissue is not solid. Bone is solid, a stone is solid, a piece of wood, a bullet, a foreign object that came and impaled the patient, a piece of shrapnel, a piece of metal. Those are solid things. Thrombus can be solid depending on where it is and what it's composed of. But in general, a piece of tissue or a polyp is not solid in nature. So the root operation of extirpation is not going to apply. They are also not removing the entire left vocal cord. They're taking away the polyp only. A polyp is a piece of growth. It typically is a sac that bulges out, almost like a hernia, except one difference between a hernia and a polyp is typically smaller, and it typically forms in an area where there are mucous membranes, such as the colon, the rectum, throat, etc. So the root operation of removing a piece of tissue from an organ, not taking the entire organ, would be excision. So we're going to index the main term of excision, then the anatomical location, and we get 0CBV. Then we have 8 for our endoscopic approach. No device is left in the patient, no device, no qualifier, ZZ. So we end up with 0CBV as in Victor, 8ZZ. I'm sorry guys, my allergies are really not having a good day, so I'm sorry I keep clearing my throat. Number 3, tracheal bronchoscopy. So patient is having, if we break down this word, this patient is having an endoscopic procedure to look at the trachea and the bronchus. That's all we know. We have nothing about that it was a biopsy. We have no information documented that anything was removed from the patient during this procedure. All we know is that the physician looked down their throat and at their bronchus. And therefore, the root operation is inspection. We're going to index the main term of inspection, then the location. We get 0BJ0. Endoscopic approach is 8. No device is left in the patient at the end of the procedure. And no qualifier. 0BJ, 08ZZ is our final code. Because all we know is they just basically did a look around. They didn't take anything away and they didn't put anything in. Number 4 is documented as an open diaphragmatic hernia repair with a Prolene mesh patch. So this patient has a hernia in their diaphragm. The physician can't just sew it up, push back. A hernia means a piece of tissue has bulged out in a place it shouldn't be. Sometimes they can just push it back and maybe suture the top so it doesn't pop back out again, but typically there's a weakness in that area. So if they just push it back and don't put something there to keep it from bulging back out again, the patient's going to have a recurrence. So they often use mesh. They're putting mesh, which is a synthetic substance. It's not a biological something. It's something that's made by a company. So they're putting that over that area of that wall. In this case, the wall or the area is the diaphragm. When we look at our root operations definitions in our Appendix A or in Chapter 1, repair would be one option, but he's not just repairing the area, he's also putting in this mesh. So the intention was to fix the patient's hernia, but this patient's hernia required the use of a non-biological substance in order to do that. So the best fit is supplement. Supplement is defined as putting in or on biological or synthetic material that physically reinforces and or augments the function of a portion of a body part. It says explanation. I'm reading from Appendix A of your coding manual. It says the biological material is non-living or is living and from the same individual. In this case, it's non-living. The body part may have been previously replaced, and the supplement procedure is performed to physically reinforce, which is what's happening here, to physically reinforce and or augment the function of the replaced body part. Includes examples of herniorrhaphy using mesh, free nerve graft, mitral valve ring, etc. So the root operation is supplement. We know its location, anatomical location is diaphragm. It's also noted as being an open procedure. We go through our coding steps. We end up with the code of 0BUT0JZ. Because something was left in this patient. That's what the J reflects, because this is a mesh synthetic material. Number 5, I didn't type out everything in your textbook, so you might want to read it, but it says the patient is going to have a thoracoscopic lobectomy. Patient has lung cancer, right middle lobe specifically. Patient also has extensive pleural effusion. And though the physician was doing an endoscopic procedure, because of the pleural effusion, he had to convert it, he or she, the physician, surgeon, had to convert the endoscopic to an open procedure, and then did a successful lobectomy. So this surgeon removed an entire lobe of this patient's lung due to the patient having cancer. Also, this started out as an endoscopic or a closed or endoscopic procedure and then moved to an open procedure. Per ICD-10 PCS guideline, we have to assign 2 codes. One is for the endoscopic and the other is for the open. When the physician did the endoscopic procedure, he didn't actually do anything during that procedure. He didn't remove any lung because he couldn't because of the pleural effusion. So the root operation for that procedure is going to be inspection, because that's all he did in that part of the procedure. All he did was an inspection. The anatomical location, we know code ends up being 0WJ94ZZ just for the inspection. Then it was converted to an open procedure. Again, we know the location. He removed the right middle lobe entirely. And in ICD-10 PCS, that part of an organ is considered separate. And because the entire right middle lobe was removed, it's the root operation of resection. You would index the main term of resection in the body part. You end up 0BTD as in dog. And then you code 0 for open. No device was left. No qualifier. You end up with 0BTD0ZZ. The next one is an adenoidectomy, or a removal of adenoids. In this case, they were removed via electrocautery. So they weren't cut off. They didn't use, his physician did not use a scalpel. He used electric, she, the physician, surgeon, used electrical current to remove this patient's adenoids from their body. So we can't use excision because they weren't cut away. We can't use extirpation because they're not solid. Adenoids are a part of your body, but they're not solid. They weren't pulled from the body. They were electrically cauterized. So we can't use extraction. Nothing was inserted. Nothing was repaired. There's no patching, no supplement. The best root operation is destruction. Destruction is defined as physical eradication of all or a portion of a body part by the direct use of energy, force, or a destructive agent. So electricity is a type of energy. Therefore, we would index the main term of destruction. Then we have the adenoids. And from an anatomical situation, your adenoids are visible when you open your mouth. I'm sorry, when you look in your nose. They are not, you have to cut to get to the adenoids. They're right there in your nose, and they can be seen by looking up your nose. Pushing, typically pull your head back a little bit. And the physician has his little light and his little microscope thing on his end of his light thing on his head, and he can look into your nose very clearly. Plus, they have the light shining on your face so they can see what they're doing. So you have your adenoids. You have a picture of them on page 199. So there's no cutting to get to the adenoids. So the approach would be X for external. Our code ends up being 0C5QXZZ. Number 7, we have a 4-year-old child who's having a frenulotomy. He's having a cutting of that little piece of tissue on the bottom of your tongue. He's having it cut to correct his condition of what's called tongue tie. This is a common thing in children. Well, here's a picture. This is what we're talking about. This thing is too long, too big, shouldn't be there. We all have this. This is natural back here. This is not. This is going to cause a kid not to be able to talk properly. And in some cases, it happens in infants and they can't get their nutrients properly. They can't breastfeed or take a bottle properly. So they're going to cut this. So the objective is not to cut it. The objective is to release so this child's tongue can move in the correct way. Remember, your root operation is the objective or the intention of the procedure. The root operation release is freeing a body part from an abnormal physical constraint by cutting or by the use of force. That's exactly what they're doing in this particular procedure. They're cutting this to release it so that this child's tongue will work in the correct way. Release is our main term. Anatomical location is tongue. We go through the coding steps. We end up at 0CN as in Nancy, 7XZZ. Looks like I have some misspelling here. Number 8, we have an endoscopic procedure, which is the stenting of the trachea and the right main bronchus for a patient with bronchial cancer. So we have two anatomical locations as far as ICD-10 piece is considered. The trachea and the bronchus are two separate anatomical locations. They both were done, or both had the same root operation or the same intention. They both were stented. But because there's two anatomical locations, and when we get to the table, the 0B7 table, we see there's two separate body part values, one for trachea and one for bronchus. Therefore, we have to assign two codes. So what is the objective of stenting? Stenting is going to open up a tubal area. In this case, that tubal area happens to be the bronchus. This patient has bronchial cancer. Opening up would be expanding. Therefore, the root operation is dilation, expanding an orifice or the lumen of a tubular body part. Your trachea, your tube that you breathe through, your trachea, your those are tubal or luminal. They're tubular or round-like organs or structures in your body. We're going to index the main term of dilation, trachea, and then bronchus. We end up again with two codes, 0B718DZ, 0B738ZZ. So the only difference between these two codes is the body part value is different. Number 9, this patient is having a thermoplasty of the left lower bronchus for severe persistent asthma. So this is a picture of a thermoplasty procedure. It's a newer treatment for asthma patients. You can see they're inserting some type of instrument into the bronchus area. In the key, it gives you some more information. It talks about a thermal wand, which is this element here. And a thermal wand is going to be using heat. So again, this is not a cutting. They're putting this wand, they're putting heat down this patient's bronchial area to destroy some of the excess muscle or excess tissue that has grown there or has always been there because the patient has asthma. We can't use excision because there's no tissue being cut away. We can't use resection because they're not removing any of the patient's organs. We want to use something that reflects them doing something, but it has to have some kind of energy or non-surgical cutting involved. That again falls to the root operation of destruction, which is defined as physical eradication of all or a portion of a body part by the direct use of energy, force, or a destructive agent. Again, we're using thermal heat, that's energy, and we're doing it to a portion of a body part. We're going to index the main term of destruction, and we have the location, which is the left lower bronchus. We know it was done via endoscope based on the clinical information that we may have researched or I don't know if she talks about it in your textbook. But it is done via bronchoscopy. Because again, we're talking about anatomically, we're talking about the bronchus is on top of your lungs. They're going to go through the mouth to get to them. There's no documentation of cutting into this patient. This is bronchial thermoplasty. How are they going to get to the bronchus? They're going to go through the mouth through an endoscopic device. End up being 0B5B8ZZ. I would love to see the word endoscopy done here, but again, if you had the entire chart, you would know that it was an endoscopic device, hopefully. I'm just looking back in your textbook if she really talks about this particular procedure. She does not, doesn't look like it. But it does say on page 201, it says about procedures frequently performed on the throat and the respiratory system or laryngoscopy and bronchoscopy. Again, how would they get to the patient's bronchus? Typically via a bronchoscopy. So it is an endoscopic procedure, which is why we would choose the body part value the surgical approach value of 8. And the last one is a repair of a cleft palate, of the hard palate, via an open approach. In this one, we don't have a lot of information. We don't know exactly why it's being done. This is because we only have a cleft palate, so they're going to be fixing it. We do know that. And a patient with a cleft palate is having work to make their palate of their mouth work right, work the correct way. That identifies that the root operation is repair. Repair is defined as restoring, to the extent possible, a body part to its normal anatomical structure and function. So this patient has a cleft hard palate. They're restoring it back via an open approach. The root operation is repair. We know the anatomical location. 0CQ2, 0ZZ is the final code assigned. If you have any questions on this presentation, please let me know. I will post this document in your course. It will be repetitive because the key is already there. And the key, though, you will not see any verbiage of exercise. You just have the answers.